We have some counties which have not even invested in rehabilitation, invested in prevention programs, and unless they took up this, we are going to be faced with a serious challenge. I think we have many things to learn about, but I just want to single those two. Having said that, let me appreciate, before I invite a few of us to say something, we have talked about what we wanted to speak to Kenyans through those presentations. I want to acknowledge that we have so many guests, and because I said we don't have the time, you will have to excuse me. I will only invite very few of us. But before I invite those I want to invite, let me mention that we have a vibrant partnership with so many of the following. The ministry has been giving us policy and guidelines that have kept us moving, and they have given us all the support. In fact, through the infrastructure of security and through the now family, we are able to be visible out there. And this one, they are in our board. So I don't know whether we are represented by the ministry, because I'll be asking them to say something, because they are critical in this. We have representation from the ministry. Maybe we don't have. Ministry of Education, I know we are actively engaged with them, and we in the board, we have an alternate to the PS, who is Rokaria. Yeah, he's a member of the board and alternate to the PS. That is our critical partner because of the issues you saw here. Secondary schools, the drug situation is worrying. It's a matter to mourn about. Young people as young as 4 years have been initiated in drug use. 11 is the mean. By 11, literally every other child is trying one or the other. It's an issue to worry about. The ministry responsible for youth affairs, NCIC, as we are going to the campaign, anything you see in terms of violence, in terms of disruption of people, campaign activities, the drug is at the center of it. And we have actually signed a memorandum of understanding with NCIC, and I can see Dr. Charo is here. If you could please stand up and wave to the crowd. That is the CEO of the NCIC, and we work very, very closely. I don't know whether I will have a second for you to read people, but I will see how the time looks like. Youth Enterprise Fund, the acting CEO, I also have seen him. Please, if you can wave. We work very, very closely with the universities, and we want to continue working with the universities. And I can see Kibage from Egerton is around. If you can wave. That is the Vice Chancellor from Egerton. And this year we are actually doing a survey on the drug situation in our universities and colleges. And we are going to be engaging very, very closely with the universities because of this. Red Cross, we have representation. Yes, the secretary indicated we'll have some 1 minute to say something. So you'll be ready to say that in 1 minute. We don't have the time. SAPTA, I saw the SAPTA, yeah, very, very, very close partner in training, and has really helped to build capacity in this country in the area of addiction management. We thank you very much for that. We recognize you. Reach out. Are they represented? I saw they had a tent. They are represented. Thank you very much. We work very, very closely. MEWA, I didn't see them with a tent. They are very, very critical, particularly in terms of harm reduction programs in the coast region. Another very, very important partner is the Tobacco Control Board. I'm not seeing the chair. We had invited her here even to say something. By the way, we have done together with TCP a national survey on the status of alcohol and drug abuse in the country, which is in the process of being analyzed, and will be shared the results very soon. And the Kenya Bureau of Statistics was leading that process. We believe it's a credible process, and very soon we'll be sharing with the Kenyans the situation, how it looks. Illegal Guides is in the board, and the CEO of the Kenya Girl Guide Association is there. If you can wave as both as the CEO of that association and of course as a board member. Kango, we work very closely. In fact, they have supported us. Kango and the Red Cross were very, very useful in terms of making this work. They've given us a lot of support, including printing some of the t-shirts we are wearing today, and we really appreciate. Now there is, of course, we have a number of rehabs here, like Life Beach, Genesis, Faith, Faith-based organization. I wanted to say we are working very closely with them, and they are very important partners. I think Slum Child, of course, my brother is there, and Chen, I saw him, and I think those are the ones I'll pick to mention. Kisel Foundation, are they represented here? We work very closely in the Nyanza region, and we are very happy. So having said that, let me see. Tango and Red Cross, you said you want to say something. I will give you a minute. Tango. Na asante sana kwa sababu ya msaada tulipata kwa kwenu, and that is even the reason why I'm giving you this microphone. Because I'm not coming until I'm clear with the speakers.
Thank you so much, Bwana CEO. Our guest of honor, the CAS, the Deputy Vice Chancellor, UOM, the Board of NACADA, the CEO, NACADA, UNODC, all civil society organizations in this room, and all communities present. Good afternoon, and all protocols observed. So I'm here speaking on behalf of the Executive Director of Kango. He couldn't make it because of an urgent situation. So he says, today also marks the 10th anniversary of what we call the Support, Don't Punish campaign, which is a global day of action where civil society organizations in many cities of the world come together and they just say, support, don't punish the people who are using drugs. So, and that is what NACADA has been showing us here since morning. We support the people who are using drugs, we don't punish. So a wise man in Kango, who is the CEO, always says, everything worthwhile is done with other people. NACADA, thank you so much for working with all of us. In this 2022 Global Day of Action, as Kango, we are calling on you and all of us to show our communities in all the parts of the world that we can continue to work together and build a stronger system to support the people who are using drugs. Thank you so much and have a nice day.
Asante, you have used the time I located the Red Cross. Yeah. I'm also giving you a minute and a half.
To our chief guest, and to all distinguished guests, ladies and gentlemen, all protocols observed, good afternoon. I want to take this opportunity, first and foremost, to appreciate NACADA. It is indeed a very good job that you're doing to mobilize the country, to mobilize all the different stakeholders to rally together behind this very noble cause of fighting against drugs and substance abuse. My name is Annette Msabeni, my apologies, and I am Deputy Secretary General in Kenya Red Cross. I am speaking on behalf of Dr. Asha Mohammed, our Secretary General, who is out of the country on official duty. Indeed, the statistics have been provided this morning, and it is very, very sobering. When we listen to the number of people who are dying, the number of people who on a daily basis are becoming addicted to the different drugs and substances, it is very worrying. And more so worrying is the fact that it is our youth, and statistics show that youth between the age of 10 to 19 are very, very affected. In the last 2 years of COVID, this even became worse. For us as a Kenya Red Cross, working in all the 47 counties, through a network of young volunteers, we see this. We see the effects of drugs on the young people. We see the effects of drugs on their mental health. And we also see the effect of mental health on increasing drugs and substance abuse. So indeed, it is very critical that we come together and target specifically the youth with differentiated services that seek to address their different issues, their different challenges, that seek to speak the language of this youth so that we can be able to fight this vice. As Kenya Red Cross, we continue to be on the front line to support the national government and the county government in this fight. We continue to do a few activities, for example, mobile health. We have an interactive 24-hour toll-free line, 1199, where youth are able to call and the public is able to call and find services, including mental health and psychosocial support. In this fight against drugs also, we have established a rehabilitation center in Lamu that offers addiction management and curative services, both on outpatient and inpatient, particularly to the population in Hindi, but also targeting largely the whole coastal strip where this problem is also fighting. We continue to run harm reduction interventions through prevention and awareness creation, and really targeting at the community level. Through the Global Fund grant, we are happy that we are able to work with a number of sub-recipients, some of whom have been mentioned here, SAPTA, Reach Out, MEWA, and many others. We want to really appreciate the good work that you continue to do on the ground to serve these populations. And so, because time is not on my side, they're looking at me, I just want to give the commitment of the Kenya Red Cross to continue working with the youth, to continue implementing harm reduction programs, and we look further to working together with NACADA and generally with the government, seeing our role as auxiliary to government. Thank you very much. I hope I've done well.
You've done well too. You've done well. Yes, Corona, Red Cross actually were strong partners when we were starting the military, and they helped us a lot in starting that program. Because of going into elections in another 40 plus 1 or 2 days, NCIC come and deliver a message, because we would be going out together to tell Kenyans that you shouldn't be given 50 shillings to beat your neighbor, or to kill, or to harm. Thank you very much.
Thank you very much. I appreciate the chief guest and all protocol observed. This is a wonderful, wonderful day that as NCIC, the National Cohesion and Integration Commission, feels so good that our partners NACADA are creating more awareness and they are fighting strongly against the drug abuse. As the CEO mentioned, this is our greatest monster, because the political class uses the young people or the youths in Kenya. They give them drugs and then they go and cause violence in those political rallies. Now, my call to you, by the way, we have 43 days to elections. 43 days. That is 1 month plus a few days. And as NCIC, we are calling all the Kenyans to make sure that on that day, wake up early, go to the polling station, cast your vote, and after that, go home. If you're not going home, go to your workplace and then wait. Don't stick around the polling stations. Don't wear your t-shirts, to support your political parties on that day. Let's be calm. And to the politicians, the candidates, let's be prepared to have two speeches. That one of accepting lose or accepting the win. Because in any competition, there must be a winner and there must be a loser. And if you lose and you are not comfortable with that, the Judicial Service Commission and the courts have prepared and they are ready. They have put their systems ready for any person who is aggrieved to launch his case, and everything will be done. We want to support, and NCIC has this strong mandate to ensure that we have a peaceful elections. And to all Kenyans, remember that election is just an event where all the Kenyans are supposed to go and exercise their democratic right to select their leaders. So, amani milele, milele amani. Thank you very much. See you.
Asante sana. I only sympathize with you because the Kenyan politicians don't lose. This was a member of the board until not long ago, and guest of honor, Chipukisi, by the way, is a passionate campaigner. This week he has been going around mobilizing Kenyans to participate in this function. He was on this track, this big track you saw with those speakers. Just say hi.
Asante.
Salimia your colleagues wengine wapo.
Asante sana. Itakuwaje? Kwani mnasikia itakuwaje? Nionyeshe mkono moja kama you are proud of what you are doing today. Asante sana. Tupigeni na kada makofi sana sana for the good job you are doing. Congratulations guys. I'm so happy to be here. Kwa wale hawanijui naitwa Chipukisi. Kazi yangu ni kuchekesha watu, lakini pia nimekuwa nikifanya kazi na nakada kuambia kufanya hiyo kazi yote ambayo umeona imepresentiwa hapa, kwenda huko kwenye mtaa kuongea na vijana kuambia waache mihadarati. Niseme hivi kwamba ni kweli sio amesema we are mourning, lakini sio I want to encourage you that there is life after death, sio? Hata hii mazishi kiisha tuko na maisha huko mbele. Kwa hivyo now that there is life after death, I want to encourage everyone that it's important for us all to come together like we are. Keep on encouraging each other to fight this deadly disease called alcoholism na madawa. Tunapoteza vijana wengi sana kwenye shule, kwenye hospitali. So this is not one of those popular conversations or jobs, but tuendelee kujaribu, tuendelee kuzungumza, kila mtu afanye kazi yake na tuombee taifa letu, si ndio? Kama vile muhenga Steve Simple Boy anasemanga, vijana Swasiki vijana fresh baridi. Asante sana.
Thank you very much. He's a very passionate gentleman in terms of this campaign, and asante sana. And now, Chair, come and introduce your board and say something, then I can proceed from there.
I stand on the protocols that have already been established earlier. The Chief, the CAS, Minister of Interior, and the Coordination of the National Government, Madam Winnie Kishui, and all the protocols observed. I'm very happy to be here. Good afternoon. Before I read my speech, I would like to introduce our board members. Thank you. We have Priscilla Gadiga, and you have seen the girl guys who are here. She's in charge of them. Thank you. We also have Dr. Roy Tedewa. I think he will join us later. And we have Alice Mutuma. And we also have Dr. John Cheruiyot. And of course, we have our CEO, Victor Okioma. Can we clap for them? It's because all the work that you have seen also passes through their hands. So the chief guest, it gives me great pleasure for you all to join us and to join the entire world in commemorating this year's International Day against the drug abuse and illicit trafficking, in short called IDADA. On behalf of the board,
of directors, management, and staff of NACADA, I welcome you all to this commemoration and thank you most sincerely for honoring our invitation. Because sometimes you can invite people and they don't come, isn't it? So we really are appreciative of you for having put all your things aside just to be with us. We really appreciate you. Thank you. My sincere appreciation goes to our chief guest, the Cabinet Secretary, Ministry of the Interior and Coordination of National Government, who is very ably represented by the CAS, Madam Winnie Shui, for finding time from her duties, because she has been very, very busy last week. But you can see her here and very calm, isn't it? Yeah. So we really appreciate you taking time from your busy schedule to grace this occasion. Thank you very much. This shows that we are also pleased to host you as your presence today means that it's a clear indication and demonstration of the government's commitment and leadership in the fight against drug abuse and illicit trafficking. My heartfelt gratitude also goes to all stakeholders at national and international levels who have continued to work with NACADA in realization of the authorities' mission, which is a society free from drug abuse. Ladies and gentlemen, June 26th is a significant date in NACADA's calendar, as it provides an opportunity for us to take stock of the gains made, challenges encountered, and chart a collective way forward in the fight against drug abuse and illicit trafficking. Each year, the United Nations Office on Drugs and Crime, UNODC, gives a theme that forms part of the IDADA commemoration. I'm particularly pleased by this year's theme, which is addressing drug challenges in health and humanitarian crisis, as it emphasizes the need to respond to the plight of persons with substance use disorders in difficult and unpleasant settings. Indeed, the COVID pandemic has proved to us that health and humanitarian crises can worsen the alcohol and drug abuse situation, as it can accelerate the plight of those affected, making it difficult for them to access care and support services. In addition, the such crises are noted to increase the people's vulnerability to initiation to drugs and resultant addiction. And I think you have been told here very well how the COVID crisis exposed our young children to some of these things. So it is a fight that we have to continue really, really hard. Indeed, during the COVID pandemic, the related movement restriction, we observed increased incidences of drug abuse, particularly in homes, in the presence of children. We also noted an upsurge in online sales of substances which further exposed young people to the risk of drug use, as there is ease of access. There were so many, it was so easy for people just to buy all these things online. And that's why we are saying we should open our eyes and fight very hard these vices. This and many more worsen the drug situation in the country and worsen the situation in the country, and we are yet to recover from these effects. Indeed, during the COVID-19 pandemic and related movement restrictions, we observed increased incidences of drug abuse, particularly in homes, as I said, in the presence of children. And it is not only that, even up to now, we still see things going around. For example, the mothers who have babies, they smoke and they push the smoke into the mouth of the babies. Yeah, so these things we have to be really look at them and fight them. So ladies and gentlemen, In response to the growing challenge of alcohol and drug abuse in the country, NACADA, as the legal agency, has instituted a multi-sectorial approach that ensures the participation of all the key stakeholders. And I think our CEO has mentioned some of them. These are partners drawn from the public sector and faith-based organizations and other civil society organizations. The approach is in realization that the challenge of alcohol and drugs cannot be handled by one single agency, owing to its multifaceted features and complexities that cut across all sectors. This coordinative role is enshrined in our mandate as NACADA that is derived from the National Authority for the Campaign Against Alcohol and Drug Abuse Act of 2012 and the Alcoholic Drinks Control Act of 2010. We also leverage on the legislation of other government ministries, departments and agencies who are represented in the board to effectively respond to the complexity of alcohol and drug abuse in the country. Through these concerted efforts, much has been achieved, as you have been seeing from the presentations that were made earlier. And we take pride in the many programs we have implemented related to prevention, treatment and rehabilitation, compliance and enforcement, and policy development. In particular, we are pleased at the contributions from our partners and more so our parent ministry in the continued operationalization of the Miritini Drug Rehabilitation Center. And you have been told about it and even been told the photos, given the photos on them. This is a center that arose from the presidential directive issued on 28th August of 2015 that the NYS substation be transformed into a rehabilitation center. The facility is up and running with over 350 clients, receiving various services such as treatment for numerous ailments, counseling, rehabilitation, skills development, and integration into the community. Ladies and gentlemen, as I close, allow me to once again thank all partners and stakeholders who have joined us in their various capacities to commemorate this day. The University of Nairobi has been a strategic partner, and I also note the presence of Egerton University and all who are here from the Education Center. We thank you all for making this event a success. I wish to remind us all that the challenge of alcohol and drug abuse is multifaceted and requires a multi-sectorial approach. And all of us here as participants, we have to play our part. I therefore invite you to partner with us in reaching out to all the society. We are open to work with all like-minded institutions and individuals towards realization of a society free from alcohol and drug abuse. Should you require any assistance or information, do not hesitate to call our toll-free line, which is 1192 for help. Thank you and God bless you all as we work towards having a free alcohol and drug abuse country. We all love our country, don't we? How many people love our country? Can you put your hand? And we have to work very hard so that Kenya continues to go ahead because we are leading in so many things and we also have to lead in this particular issue. Thank you for listening to me and God bless you and have a lovely day.
Thank you very much, Chair, for that statement. And because of time, I'm moving very fast. And we now want to listen to the statement by the Director General, United Nations Office on Drug and Crime, UNODC. And I am told Dr. Faisal will deliver that statement. Welcome. That is a statement from Vienna, and they will tell us why they decided that it should be, the theme should be the way it reads. Welcome.
Yeah, so my apologies, CEO. So this year, yeah, this year, the UNODC is launching the World Drug Report on 27th, that is tomorrow, because it's a Sunday and they plan as such. Therefore, the message to the member states by the executive director, Ms. Hada Wali, will be available only tomorrow. And also, the findings of the World Drug Report 2022 will be available tomorrow. So my apologies on that because I thought that it will be given to regional officers so that we read out a message on that day. Nevertheless, let me first of all congratulate NACADA. I mean, for the exceptional work that they've been doing and for the improvements that I've seen over the past 5 years. The chair of NACADA did mention something that I've noted down, and I wanted to say, drug abuse is a multifaceted problem, and which requires a multi-dimensional approach. So she said it, and I'm happy that it's there. Over the years, we've been working with NACADA to provide technical assistance, and now I see from this morning in all the presentation, I think NACADA is already at the top. Kenya is already at the top, and I'm very proud to be associated with NACADA in achieving this. So a big thank you, a big congratulations to NACADA, the CEO, the members of the board of NACADA, the staff of the NACADA, and everybody with whom we have collaborated in the past few years. It has been excellent work, and now I can say I've seen that other countries on the African continent are coming to benchmark in Kenya. So I used to tell my colleagues at NACADA that Kenya is leading and others are following in Africa. And I'm very happy to see that, and we'll see the growth this morning. So I prepared something that I want to say, and I don't want to go without mentioning it because it's about UNODC. Of course, Madam Chief Guest, all protocol observed. It is with immense pleasure that I find myself in your midst today to commemorate the International Day Against Drug Abuse and Illicit Trafficking. The World Drug Day. This World Drug Day, UNODC addresses existing and emerging transnational drug challenges stemming from situation of crisis. UNODC continues to advocate for and protect the rights of health for the most vulnerable group, including children and youth, people using drugs, people with drug use disorders, and people who need